Hello, everyone. It's Wednesday, October the 28th. Since Monday, we have had 12 additional deaths. As you can see, this thing is surely still right with us. It's all across our nation. We have got to absolutely keep everyone in our thoughts and prayers, from everyone across this nation, across this world or globe, and especially those right here in West Virginia. Our 433rd death is a 79-year-old male from Upshur County. Our 434th death is an 89-year-old male from Cabell County. Our 435th death, a 79-year-old female from Cabell County. Our 436th death, a 57-year-old male from Kanawha County. Our 437th death, an 83-year-old male from Fayette County. Our 438th death, an 87-year-old female from Jefferson County. Our 439th death, an 83-year-old female from Cabell County. Our 440th death is a 54-year-old male from Raleigh County. Our 441st death is a 77-year-old male from Upshur County. Our 442nd death, a 73-year-old male from Mercer County. Our 443rd death, an 85-year-old female from Cabell County. And our 444th death, an 84-year-old female from Ohio County. We stretch all across this state. If you'll just look at all these counties, they're from all ends of this state. Mostly, with the exception of a 54-year-old male and a 57-year-old male, all these people are in their 70s or 80s. It's just a crying shame. I mean, that's all there is to it. But it is something that this world has cast on us, and it is a pandemic that we just never dealt with anything like this before. But please, just over and over, I say, don't let these people become just a number. They're great people. They've given us so much, and I pray in every way I possibly can for all of them. But please keep them close to your heart, that's for sure. Before I just go on to these numbers, like I said over and over, it's been an honor beyond belief, trying to guide us through this pandemic and be your governor and everything. But I'm going to tell you just straight up as I can be, the calling of these every day is tough, and I hate it for them. And I just don't want anybody to believe I'm just going through the exercise of calling off a number. I love these people, and I just pray in every way that everything, some way, somehow, will be okay. 358 new positives in the last 24 hours. Our daily positivity rate, 4.29, is too high. Our cumulative positive rate is at 2.88. Our active cases are down, and they're down in a big way, and I'll tell you about that in just a second. They're down to 4,557, and our recovered cases are at 18,071. And Jordan, pull up a chart just one second while I'm telling you this. Our hospitalized patients are at 226. Pull up the chart, and let me go back to this just one second. But you'll see the great big turn in the recovered cases on the top, and that's been climbing all along, but the active cases just went shoo and dropped straight down. And from that, we were at 5,100 active cases, and we went to 4,500, just boom. Well, what happened was just this, is in Kanawha County, we had 496 cases that were active, that the paperwork was finally processed, and all of a sudden it comes in just boom, in a big slug. And so, you know, our active cases just fall, you know, right out of the sky. I would say to Kanawha County, and I would say to any county, you know, that really and truly, if we're having trouble processing the paperwork, we have said it over and over and over. We're pleading with you. If you need additional assistance, the National Guard is standing ready. Absolutely whatever you need to be able to process paperwork timely and really make things happen in a more, you know, efficient manner and everything, just let us help you. We're wanting to help. We're standing ready to help at any time. Now, let me just say this, you know, in this situation, you know, it's not influencing, you know, whether you're green or, you know, whether you're yellow or whatever. I mean, it did by the number of tests that we've been running and everything. We've seen Kanawha County drift into the green now, which is terrific. I mean, it couldn't have been better. We tested over 2,000 people in a week, and we found 85 spreaders that were positive that we were able to do something about. And so let's hope and pray that as we move forward, you know, that things will just continue to get better all across our state, Kanawha County, every county and everything. But with that, let me just say just this. Goodness gracious, you know, there's situations that come up all over the place. You know, we have a soccer team in Boone County right now. And God knows I want to help. I want to try to help them in every way. You know, Boone County has now turned back into the gold. I'm going to ask our experts and SSAC and any and everything that if there's any way that they can be helped, you know, from the standpoint of them being able to participate in our state tournament. Now, you just think about this. Here's a bunch of kids that really and truly, I think they're undefeated. I think they're nationally ranked. You know, this isn't their fault. I mean, this isn't their fault. You know, I mean, this is a simple thing that maybe the people in Boone County didn't come out and get tested as much as they should have or whatever it may be, but for crying out loud, we're trying every way we possibly can because there's so many circumstances. And don't get me wrong, it may very well be that between the experts and everyone out there that there may still be nothing you can do. You know, but with all of that, you know, let me just say just this, that as we try to address every situation, and believe me, B, in my situation, you know, go to school, don't go to school, play ball, don't play ball, all the different things, you know, all the balls that you're juggling all the time, you can't ever really come up with an absolute right answer. You just do the very best you can possibly do. You know, for the critics of the you know, the colors on the map changing and whatever and being fluid, are you kidding me? Really and truly, at the end of the day, all we've tried to do is do the right thing, do the safest thing that we can possibly do all the time. The very safest thing we can possibly do. You know, I said it over and over and over, you know, nobody's ever experienced this pandemic that are living today. Nobody has ever experienced a pandemic that's living today for all practical purposes, unless somebody out there is 1,800 plus years old. Now, with that being said, there's surely no playbook, and really and truly what West Virginians and these great health experts have done, it's unbelievable. I mean, we have put together a playbook in a matter of weeks, and we had to tweak a little bit and change as we went forward and everything, but we've got something that's really been really, really good. Now, to apologize for that, are you kidding me? We need to be proud of that and proud of what we've done in West Virginia. But let me go back and let me just say just this, that if you need help and it will help expedite things, please let us help you. Because there are people that are impacted in every way. Just people worrying about the fact that we've got 5,000 active cases and all of a sudden it looks like, no, we didn't really have 5,000. We really only had, 4,500. It's better. And everything, but it could have been, the processing of paperwork could cause an issue that would cause a bunch of kids not to be able to participate, a bunch of kids that we need badly, first and foremost, way above sports, to be in school. Whatever the situation may be, if we can help you from the governor's office, from the National Guard, expedite things and make things better, that's what we want to do. That is exactly what we want to do. When we left this press conference, on Monday, one of the directives that I went right and put off at that point in time was some way, somehow, we have got to increase the level of our ability to test and process the test even more than we already have. And we're in the process of trying to do that right now. Now, let me go back to just this. Today in West Virginia, I said just a second ago, we have 226 patients that are hospitalized. That's the highest we've had. We had 222, I think, on Monday. Today in West Virginia, our effective reproduction number, that RT number, is 103, which is down some, and we're now the 5th best in the entire country. Now just think. You got 358 positive tests right now. We're testing a lot. That's really good. But 358 positive tests. Your percent positivity for the day is at 4.29, way too high. Your positivity cumulative test number is at 2.88, and it continues to go up. And yet we're the 5th best in the country. And what does it tell us? It tells us just this. This disease is running across America, and running across America in a tough way. So we got to tighten up. We just got to tighten up even more. Now, I don't mean tighten up from the standpoint of shutting something down. I mean, West Virginians, you've got to tighten up on wearing your mask and just trying to do better. Mingo County has now gone red. Wyoming County remains in the red, and Mingo County is now in the red. We have 5 counties in the orange: Berkeley, Braxton, Monroe, Morgan, and Wayne. I will promise you that if we, in these counties, will just get the people out and get tested, these colors and these numbers will change. Now, that'll be good for going back to school, or that'll be good for the possibility of playing ball and all that stuff. But what will it be the best for? It will be the very best for finding people that are spreading this thing that we don't know about. We got to test. The more we can test, the more we'll know. Please, in these counties especially, get out and be tested. I'm going to say it one more time. Please, in these counties, go get tested. Absolutely, it will give us information. It will make us better. And absolutely, it is the only way that we can stop this thing. It's the only way. Please go get tested for everyone. Free testing is all up there on our website. You should be able to see that. We're going to be in the red and the orange counties right now, and we're going to be testing, and we're begging you to go get tested. The drive-through pharmacy testing is absolutely working, and I just encourage you to go and take advantage of that testing. It's absolutely nothing. the lady that's my executive assistant, and I hope she won't get after me about this by giving her name, but everybody knows Pam Rhodes, and Pam yesterday went, and took advantage of the Walgreens testing and just went on her own and made an appointment and went, and she said, I couldn't believe it. She said, I could not believe it. She said, here's what happened. They handed you a little kit, and you yourself did it in each nostril and put it in back in the little test tube or whatever thing, and then gave it back. She said it was so painless, and so there was nothing to it at all. Now, the only thing bad, she said, is when she got there and everything for her appointment, really and truly, there wasn't anybody hardly sitting in the line. In fact, there was nobody for all practical purposes. And so we need to have a whole lot of people that are going to do and getting a test. But she said there wasn't anything to it, and I'm sure she's fine and dandy, but she just felt that she needed to go get tested, and so in doing so, I gained a little bit more information about how they're doing everything there, and so please just go get tested. We have 22 active outbreaks and 82 confirmed cases in our public school system. If you'll just, it sounds like a goodly number, but and we don't want any. But if you'll just think about this, I think we've got well over 200,000 kids in school, 40,000, I think, teachers and maybe service personnel. If you add it all up and you say, whatever the number may be, let me make it real simple and let me make it 300,000. 300,000, what is 1% of 300,000? I think 1% of 300,000 is 3,000. We have 82 confirmed cases. 1% is 3,000 positives. We have 82. What is a tenth? A tenth of 1%. That's 300. We have 82. Did you hear me read our daily positivity number for the state is 4.29. If we were at 1% on our schools, we'd have 3,000 confirmed cases. We got, really and truly, we've got 82. So in other words, our teachers, our administrative people, the Department of Ed, the National Guard, all of our custodians, all the people that are taking care, cooks, everybody that are taking care of our kids, taking care of the building, taking care of all of our teachers, our staff, they're doing great work. Great work. So for our teachers, all of our service personnel, all the administrative, all the people that are working as adults in the school system, thank you. You're doing a heck of a job. Keep it up. We've got 46 outbreaks in the long-term care facilities. In our churches, we've got 16 outbreaks, 14 counties. That's Cabell, Doddridge, Kanawha, Mason, Mercer, Monroe, Nicholas, Putnam, Raleigh, Ritchie, Wayne, Wetzel, Wood, and Wyoming counties. And you've heard my speech about, keeping a pew apart and wearing your mask during the whole service and really thinking hard if you're an elderly person and everything, maybe about skipping a few services or whatever, getting your, the church online or whatever. Think about it. It's probably good sense. We've got 10 active inmate cases now in corrections. All of them are at Martinsburg, and we're down to 4 staff cases. We have our third COVID death in corrections. Now just think about that for a second. I don't have the number, but many, many, many states have had in the thousands probably that have died in corrections. Many have situations that are bad, that are really, really bad, where we've lost a lot of people in our jail systems with COVID. We've lost 3 now. So the corrections people are doing a wonderful job there. Please keep that up. You know, our flu vaccines are out there. Please get that. We're at 164 million rather that have gone out or been awarded to our counties and our cities for monies. We've got the $25 million of CARES money for people, you know, on their past due utility bills, whether it be electricity, natural gas, water, sewage, whatever. And these are bills from March 1st to July 31st. You know, you should have gotten notified of this and everything. And please, please, if you're having trouble taking advantage of this and everything, call the governor's office. You know, we'll direct you to who you need to go to and everything. But if you're having trouble, take advantage of this. It'll help the utilities, but more than anything, it'll help take some undue stress and burden off of you. And we're just trying to help our people through more and more tough times. I've got one more thing, and I'll go quickly and everything, but this is for our Bureau of Senior Services. And I'm going to read a few things here, but I want to recognize our West Virginia Bureau of Senior Services today. What great work they've done, and they've done, and they've done, but just think about this just a second. In 2020, now this blows me away. In 2020, our Bureau of Senior Services has served 2.4 million meals to our seniors all across West Virginia. You realize what that is? I mean, that is 1.5 times the entire population of the whole state. They have served that many meals to our seniors. And 84% of those meals were hot prepared meals. It is unbelievable what great work they've done. This year, the Bureau has also added an additional 3,000 new seniors that are now receiving, you know, hot meals or meals. We added all kinds of new vehicles that they hadn't had in 10 plus years. And I don't know exactly the number, but we did it in 2 tranches of about 20 some or some odd number on both tranches. And so it was somewhere just short of 50 or around 50 new vehicles that they're absolutely, you know, administering and taking these meals to these great people. And gosh knows, I want to especially thank all of our county senior programs, you know, and for all that they've done and all the great work that they're doing. And throughout the COVID pandemic, our seniors have been affected the most. We know that. We know that in every way. I've got just an update. We have 43 new vehicles is what we were able to get out, you know, to our Bureau of Senior Services, and they're just doing phenomenal work. But you know, just think about this. These people, in many ways, first of all, they don't see, you know, a smiling face or a warm, friendly hand nearly as much as they should. But in addition to that, with all that's going on with the COVID situation, you know, many of them have been deprived of seeing their children or their grandchildren, and how tough can it be? I mean, really, this program is so important. Not only are they delivered nourishing food, but they're also delivered hope. They're delivered, you know, a friendly hand, a warm voice, you know, and just hope. And so we just want them to know that we're with them, and you know, it's just really important. And these people should be so commended. You know, Director Robert Roswell has, you know, Robert, you know, we've had the opportunity, we were together, you know, and giving away the vehicles and all of that stuff. And you know, what a job. What a job these people have done. And I want to encourage all West Virginians today, this week. Here's my request again. You know, I asked you about the census over and over and over, and you knocked it so out of the park. West Virginia is just unbelievable. Will you do this for me? Will you do just this? If I ask all of you and declare that this is our week, this week, now we only have a few more days left in this week, but during this week, will all West Virginians reach out to our seniors? Now, that doesn't mean go see them, but that means call them on the phone, write them a note. I mean, really and truly, probably the worst thing is all West Virginians go see our seniors. We don't need to do that. I'm not saying that. All I'm saying is I want you to just reach out. Reach out. A friendly phone call, an absolute card, a little letter, something, just something. Send them an email, whatever it may be, just something. Absolutely, to show them that you love them, you're thinking about them, and absolutely, let's just make sure we do that, West Virginia. Don't forget, the people that have given us the most wisdom, the people that have absolutely helped us throughout all of our lives and everything, don't forget them. Great job to all the Bureau of Senior Services. Great job, Robert Roswell. Great job, all the county people. Proud of you. Keep it up. West Virginia, you just continue to make me, just blow me away. You know, when they handed me this sheet of paper today and it said that we had served 2.4 million meals and 84% of them hot, I mean, how in the world do you pull it off? You keep knocking it out of the park over and over and over, West Virginia. Keep it up. Great job.
All right, thank you, Governor. Let's first go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I'll keep my comments short today. Around the country, we are seeing a clear trend, which is people are getting sicker with COVID-19. Hospitals are filling up. States are starting to think about rationing care, meaning that they're deciding perhaps of a group of people that might need a certain sort of level of care in an ICU or a ventilator. Maybe they can't serve all the people that need it. That is really a profound moment for us. And in West Virginia over the last week, we've seen 2,310 new confirmed and probable cases. We know that some of our hospital numbers are inching up. And we also know that there is about a 2 to 4 week lag between the time that we see these positive cases and we start to see the demand for hospital beds. And so as we talked about at the very, very beginning of this pandemic, we need to work together to make sure that we continue to flatten the curve, that we try to reduce the tendency that we might see a surge, because ultimately we know that not only are we seeing new cases in West Virginia, we're seeing the people that are detected with COVID positivity, with positive tests, we're seeing those people get older and older. Earlier in the summer, it was young people. Now it's people that are 50, 60, 70 years old that are testing positive in the highest numbers. So West Virginia, as the governor has asked once again, we are really pleading with you to start to really, really focus down on what we need to do, using each one of our individual power and capability to try to slow the spread of COVID-19. There's only 3 states in the country today that are in the green, meaning their reproductive number is less than 1. West Virginia is doing relatively well, but still over that magic number of 1, meaning the virus is spreading. We know that the virus is affecting older people. We know we have a very vulnerable state with our population, and we know that some of the hospital numbers are starting to inch up. So it is really the time today to take maximum effort to focus on going out and getting tested, as the governor has asked, to wear your masks, to stay physically distanced. Those two things alone, if everybody does it, will be like having a vaccine, which is fantastic. But it is really the time that we need to pull together to prevent the surge that could happen in West Virginia as it's happening in Utah, in Wisconsin, in the Dakotas, in Texas, and many, many other states where they're seeing records starting to be hit as far as the number of people that are being admitted to hospitals and starting to see the ICUs fill up. And that is a very, very concerning state of our union today. And we know that the potential is in the next month to 2 months that we'll see that happen even in more and higher numbers. So it is time for us to really pull together to do the things we need to do to protect each other, to protect our healthcare workers, and protect our vital hospital beds, ICU beds, ventilators, so that we will make it through this upcoming winter season and do it in a way where West Virginia can be a beacon for the rest of the country. Thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Update quickly on a couple of items. We're providing PPE and the reusable respirators to several nursing homes that Dr. Amjad and the strike team are working with to take care of those individuals and the patients, as well as reduce our PPE burn rate. Deliveries of PPE to a number of counties today. Working, as the governor said, at his direction to increase both accessibility and availability of testing. We're supporting DHHR in that effort to expand that and expand ready access at appropriate times so more people can go take advantage of testing. Also, we have a number of disinfection missions going on today with nursing homes and county facilities, 7 to be exact. As the governor and Dr. Marsh pointed out, on behalf of all the Guard folks who are working on the front lines of this, we ask everybody, particularly during the holiday season, Thanksgiving, Christmas, to double down on using a mask, to double down on social distancing and protecting and taking care of your families, and take advantage of accessibility to testing so that we can continue to mitigate the threat of this virus. Thank you.
All right, thank you, General Hoyer. We're going to go back to the governor for just a second.
Okay, everyone. I've been given an update here and everything. There was a mistake made, and you know, on the notes that I have, you know, as far as the total deaths that are in the state of West Virginia, you know, I just read through deaths totaling a total of 444 total deaths. The mistake, you know, on the paper that I had earlier, you know, was 444, and some way, you know, it didn't, we double counted anything, but we came up, you know, the correction is we've really only got 436 deaths in West Virginia. But since we got it wrong, you know, in my reading, you know, where I started out to 440 or 33rd death and everything, you know, the only right and respectful thing to do is reread these numbers. And I really, I am sorry that we had this mistake, but I want to read each and every one of them one more time. Our 425th death is a 79-year-old male from Upshur County. Our 426th death, an 89-year-old male from Cabell County. Our 427th death, a 79-year-old female from Cabell County. Our 428th death, a 57-year-old male from Kanawha County. Our 429th death, an 83-year-old male from Fayette County. Our 430th death, an 87-year-old female from Jefferson County. Our 431st death, an 83-year-old female from Cabell County. Our 432nd death, a 54-year-old male from Raleigh County. Our 433rd death, a 77-year-old male from Upshur County. Our 434th death, a 73-year-old male from Mercer County. Our 435th death, an 85-year-old female from Cabell County. And our 436th death, an 84-year-old female from Ohio County. Again, I apologize for us having these numbers wrong. I want to be so respectful, and I want to urge all of us to keep these people in our thoughts and our prayers. And again, I'm sorry that we had the wrong numbers, but I think the right and respectful thing to do is read them and read the correct numbers. But thank you.
All right, thank you, Governor. Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I wanted to ask a little bit more about the 600-some cases from Kanawha County that you said were recently taken off the total. Could you tell us how those were discovered? And do we anticipate that there's going to be similar situations either in Kanawha County or elsewhere in the state? Is the active case number going to continue to drop like this?
Well, Charles, I don't honestly know. You know, I think, you know, that maybe they just came in yesterday. 496 was the number, and they all just came in, you know, yesterday, just from what I can understand, in one load, and so maybe Secretary Crouch could give us more. But my point is just this: you know, if we have cases that are on the active that should have been moved over to recovered, they sure to goodness can't have 496 that just boom moved over. And so with all that, going on, especially in our small counties, if they have trouble keeping up, and the job's tough, I get it. People are working their blooming tails off. And all I'm trying to just say is just this: these numbers are really important, and how we process and everything can have giant ramifications on all of us in lots of different ways, whether it be school or sports or just how we feel or perception or anything. How we're reporting stuff on a national level, the national maps going up and everything that's going on. All those things are gigantically important to West Virginia in so many different ways. I mean, you just think about it from the standpoint of how we're reported on a national basis, from the standpoint of people wanting to come to West Virginia, wanting to move their businesses here, all the different things. We got to have accurate, timely numbers. It's all about that. It's always about that. So all I'm doing is offering up and saying anything that any county needs where we can help from the standpoint of DHHR, and especially the Guard, or me, I'm ready to do anything at any point in time. And I don't like this. I mean, when you just lay on us 496 reports, just boom, and it changes something like that, that's not, it shouldn't be that way. But Secretary Crouch, maybe you know more.
Yes, thank you, Governor, and thank you, Charles. It's a very good question. We've begun looking at those again. We monitor those routinely. We know, as the governor said, the local health departments are really pushed right now in terms of the workload when they have outbreaks. And their focus has been and should be on making sure that those outbreaks are investigated and that individuals are quarantined and that isolated where appropriate, and that additional testing is done. But we have to get those numbers right, and we are looking at a way to try to take this burden off of the local health departments. At the present time, they have to actually monitor those cases. They make calls on those cases daily. They then, at the end of that illness, the end of symptoms for an individual, they actually move that patient to the recovered category by putting an end date on there. We're looking at trying to automate that for them to the extent possible. So it's possible in the next week or two, you will see some of those numbers change as we take that burden off of the local health departments and we try to help them relieve that workload there. But we've got to get those numbers right. That's an indication of to a lot of folks in the community how much spread there is in the community, how many active cases there are. So thank you for the question. That's an excellent question.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, let me take you on a trip. Let me tell you a story. You know, we hear time and again, and you said it again today, that the teachers and the service personnel and the administrators are doing a fantastic job in our education system. The reality of going inside these classrooms, and this is not political and it's not being driven by any union, this is just the reality after talking to a lot of teachers, is that right now there's an outbreak at Logan County. I believe it's at Chapmanville Middle. The teachers have been notified, personnel, students haven't been notified yet. One positive case, contact tracing is underway. School is not scheduled to shut down. What we have is teachers who are feeding kids out of their classrooms that don't have licenses to disperse food. They aren't wearing hairnets. We have school service personnel, custodians who, for whatever reason, aren't showing up or aren't working as much, and that's putting a huge burden on the personnel who do report to work to keep things clean and sanitized, and an additional burden on teachers who are now also acting as sanitarians and custodians in their own rooms every day. You've just got a mass and a plethora of problems and situations of people pushed to the absolute brink with technical difficulties, lack of internet, lack of machinery, lack of laptops, etc. So what do you tell these people in these schools that everybody in the state's saying, hey, great job, good luck, well done. But what are we doing to actually help them as much as we can to get real help into the classrooms and to take some of the burden off these people who acknowledge that the students are falling behind without a doubt because of the pandemic, but that they are literally, in most cases, doing everything they can. Thank you.
Well, Kenny, first and foremost, I would just say this, you know, that I don't know how to recognize their contribution more than what I try to do nonstop. I try to tell the world just how hard they're working and how long the hours are and everything else. And I would tell you, Kenny, that it's going on everywhere. It's going on right here in my office. It's going on in DHHR. It's going on with all of our first responders. It's going on all over the place, all the local health departments, all the people. I mean, it is going on everywhere. What I would say is just simply just this. Now, you've got some situations to where just the opposite is going on, and people aren't coming to work or whatever it may be, you know. But you've got situations where people are afraid, and you want to be respectful of that. Kenny, you know, the only way that I can answer that and answer that in as truthful a way as I possibly can is just simply one thing, and that is just this. It's the hand we're dealt. We have got to live with this terrible killer. Now, there's alternatives and there's things you can do. We could all just go home and bubble wrap all of ourselves and think we're going to survive this that way, which is ridiculous, you know. Or we can continue to try to do the very best we possibly can with what we have to do with. And the other thing that I have told everybody repeatedly over and over and over and over, I'll help in any and every way. We have done it, and we have done it, and we have done it. Our National Guard is unbelievable what a resource that we are and we have. And without any question, I won't be able to run to the fire because I can't run now. But I'll come walking as fast as I possibly can to any fire anywhere. Kenny, I know how hard people are working. I know how difficult all these things are. I see it all around me in every way. There is no choice. There is no choice. You know, our kids have to be educated. We have got to do the very best we can possibly do with what we've got to do with. You know, Kenny, We have got the resources and we will supply every need as best we possibly can. Use us. Continue to use us. There's no way in the world that I'm going to let this thing beat me. And I truly believe with all in us, West Virginians are not going to let it beat them either. I am very, very thankful to all the work and all the absolute difficult situations that people are dealing with to try to achieve. But we're just going to have to keep just doing just that.
All right, thank you, Kenny. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. A question for the medical panel about active cases and recovered cases. I wonder what the standard is for determining what an active case is and whether and when someone becomes a recovered case.
Dr. Amjad, this is you. I'm tired of talking anyway. You know, Dr. Amjad, you talk.
Okay. Hi, Paul. That's a good question. And to put it simply, you know, if someone has COVID and they're COVID positive, we give them, you know, the 10-day isolation period. And then if they're asymptomatic or in contact with someone with COVID, we give them the 14-day isolation period. The term recovered has been somewhat debatable even within our own conversations with our medical team and epi team, because as you might have seen in some readings that people do have some complaints after COVID has, you know, been gone after a few months. But we use the term for recovered in terms of our epi data, that after someone does not have symptoms for up to 48 hours without any medication to reduce fever or any of those complaints. So as far as our data is, you know, they do follow them after the 10 or 14 days quarantine period. And without any symptoms, without any medications to relieve those symptoms, we use as recovered. However, as I mentioned, people do complain, you know, weeks on later about not being completely recovered for COVID symptoms. We're starting to read that in some literature data, but hopefully that answers some of your questions. Thanks.
All right, thank you, Paul. Next to Anna Saunders with WOAY.
Hi, Governor. Hi, panel. It's Anna with WOAY. My question is for you, Governor, and General Hoyer. I'm hearing from some health departments that they're getting denied when they request assistance from the National Guard to help with their testing sites. So I'm curious as to why that is and what criteria maybe some counties have to meet in order to get that assistance. Thank you.
General Hoyer,
Hey, Governor.
this is you, sir.
Ma'am, I know of no county that the West Virginia National Guard has turned down related to testing. If you have a specific county that's told you that, please send the information through our public affairs office and we'll contact them immediately. DHHR and the Guard have been engaged with all county health departments. And again, I know of no county that we have turned down for support.
Let me just add this. I can't fathom. You know, you're going to let me listen, everybody. Say what, Jordan? Okay. Everybody pay attention to just listen to this. You can hear anything and everything you want to hear. You know, there's every rumor known to man, but you're talking about a general in the United States Army, and that's heading up our National Guard. Is that correct? You know, now just think about it. I mean, a general that has done a phenomenal job beyond belief. There is no chance on this planet that someone has called him asking for help and he said, no, I'm not going to fool with it. You know, there's just no way in the world. He's a superstar beyond belief and there's just no chance. And the other thing is, you know, from the standpoint of, and you know, Kenny, I love you to death and taking you down that journey and everything. The journey is just as simple as this. You know, if you could see the mud that these people are wading in every day and the difficulties of all these people, that all the great work that they're doing, and for crying out loud, they're tired, just like our teachers are tired. We're all tired. You know, there is no choice in the matter. I mean, for crying out loud, you know, you'd like to have, a bazooka or tank busters or whatever like that, but if all you had is rocks, you've got to throw a rock right now. I mean, we've got to continue to try to just do anything and everything we can to get through this, and know that you've got that great general. You've got a governor that stands right with you in every single way. Absolutely, we're going to give you the resources in every way we can possibly do it to try to get you the help you need, and we're going to give you the respect and absolutely the notoriety from the standpoint of all the good stuff you've done. So just keep doing the very best we can do. But as far as saying that, they called the National Guard and they're asking the National Guard to help in this, the National Guard's just saying no, they don't want to do it and everything. I take real offense to that because I know how great they are. There's no chance on earth they're doing that.
All right, thank you, Anna. Next to John Lynch with WTRF.
Every single way.
Hey, Governor. Hey, panel.
Absolutely.
Yesterday, the county alert map showed that Wetzel County was in orange and had the third highest infection rate of 35.09 and a percent positivity rate of 5.65. If you look at the stats today, Wetzel County is green, but it shows yesterday's infection rate has gone down to 19.44 and percent positivity rate has changed to 2.49. Can you explain why and how that happened?
Okay, I can't do that. That's out of my pay grade, but maybe Secretary Crouch or Dr. Amjad can do it, or maybe Dr. Marsh, but I can't do that. I take the information from them. I listen to them.
Yes, thank you, Governor. Yes, John, the calculations are based upon, in terms of infection rate, we're looking at new cases into the county. Now, as we've talked about before, we remove or exclude from that calculation cases where the individuals might be in a prison setting or might be in a college environment where they're isolated, or a nursing home where we have individuals who will not be going back out into the community to spread this virus. So we're happy to provide those numbers directly to you on that. The positivity rate is the testing rate. It is looking at how many individuals are positive over how many tests are done. And that's what the governor keeps referring to in terms of more tests. The more testing we do, the more cases that we identify. And as we do that, the infection rate will go up. But over time, the infection rate will drop because we've identified those cases and we've made sure that those cases do not spread to other individuals. So again, in terms of your question, I'm looking at an increase there, but I'm not sure I understand why there's a question about that. But I'm happy to, if you'd like to contact DHHR later, me personally, happy to give you those numbers and show you that math directly. Thank you.
Gordon, come back to me just a sec. Was it John? Is that who? If you come back to me just one sec, John. Let me just and I don't have the numbers, but I'm a math guy, and let me just show you how this could happen. From the standpoint of if we did 100 tests and we got 35 of them positive, we would on a specific day. Now we go to 7-day average and all that stuff. But on a specific day, we'd be at a 35% ratio here, based on 100 tests. But on the other hand, if we did 1,000 tests and we got 40 that were positive, we'd be at a 4% rate, number. And so the net of what I'm saying to you is just as simple as just that. It's just purely a function of the number of tests taken, because your positivity rating or test percentage will absolutely should significantly come down with an increased testing amount. That's why we urge everyone, go get tested, go get tested, go get tested. But John, stay with me. Just think just about this. If we don't test and everything, then really and truly the likelihood of what we're doing is we're only testing the sick people. So just think about it. So what happens if in Wetzel County there's only 9 tests done, and let's say 7 of them are come back positive? You know, that's perfectly possible. But the problem is just this: if all we're doing is testing the sick people, then the people that are asymptomatic out there, we never find out who they are. And so that's why we are beating the drum absolutely nonstop, telling everybody to go get tested. Because the more we test, the more spreaders we identify that we'd never catch before. So that's probably what's happened to these big swings in the numbers. But John, follow up and call Secretary Crouch, you know, and he'll go through the numbers better, because we want to be 100% transparent all the time. But I'm betting that it's absolutely because we have dramatically increased the testing. That's why the numbers have done what they've done.
All right, thank you, John. Next to Taylor Stuck with the Herald-Dispatch.
Hi everyone, it's Taylor here. Last week, I was at the Cabell County Board of Ed meeting, and an elementary school teacher got up and she was talking about, she had a student come up to her who said he just got out of quarantine and he had shame on his face. And that got me thinking, what can we do to help combat stigma and shame associated with maybe a COVID diagnosis or just being in quarantine? Whether that's in schools or maybe a nurse who is positive in a hospital or a staff member at a nursing home. How can we just make sure that there's no stigma associated with that diagnosis? Thank you.
Well, look, gracious, what, you know, I mean, what a sad question in so many different ways. You know, how in the world could anyone, well, I know, I mean, this day and time, especially with all the social media stuff and all the stuff that goes on, it's you know, it's driven us in a lot of different ways, has it not, to bullying and different things that really have caused a lot of really significant stressful mental problems and on and on and on all across our society, because people have been mean to others, you know, when it really boils right down to it. How in the world could anyone feel shame and everything? First of all, there's no chance that it should even be a part of any society, because that's all there is to it. But just think just for a second about this. The most powerful man in the whole world ended up with COVID. You know, that tells us it's just this, that this is everywhere. Everywhere. No one should feel shame. And so I couldn't really understand all the exactly everything about your question, but from my standpoint, all I would do is say that there's no place for that. There's no place for anyone to drop their head. There's no place for anyone to feel any level of shame, especially from the standpoint of COVID, because it's everywhere.
All right, thank you, Taylor. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet members. I'm wondering about the number of hospitalizations, and maybe this is best directed to Dr. Marsh, but anyone wants to jump in. 226, I believe, and that's the highest level we've had to date. I know that St. Francis Hospital here in Charleston had been activated as a surge facility for COVID-19. Is it in fact being used, or are we getting to the point where other facilities are getting so overwhelmed that they're going to have to open up St. Francis and use it in earnest? I'm just wondering about its status.
Well, Mark, I don't really know, and Dr. Marsh is going to be able to add a whole lot more to this than me, but I can tell you this, that we constantly are erring on the side of caution. Dr. Marsh will do the same thing in just a minute. I think he should get into the fact that we're not overwhelmed. We're not anywhere close to overwhelmed at this point in time. I don't really know about St. Francis, but at the same time, it is our job. our job to constantly be cautious, because we don't want to get in a situation where we're overwhelmed in any way in West Virginia. But Dr. Marsh, if you could add to that, please.
No, thank you, Mark. And the governor is 100% accurate. We certainly do have bed capacity, and we're not being overwhelmed by COVID patients at this time. But what we see is that we see nationally that COVID hospitalizations are really picking up. We know that West Virginia has a very vulnerable population. We know that we're seeing more older West Virginia residents become infected with COVID-19, and we see the beginning of an increase, as the governor pointed out. And so we're really looking ahead in a way that we want to make sure that we are doing everything we can to reduce that spread today, because we know that if we would get a surge in COVID-19 cases, that will require us to have more hospitalizations, ICU hospitalizations, people that need, critical illness treatment, whether it's with ventilators or others, that we can reduce that risk today by really calling on each West Virginian to exercise their power to reduce the spread person to person of COVID-19. And we also want to make sure that we are working hand in glove with our hospital systems, including St. Francis, to make sure that we have all of those plans laid out and contingency plans laid out so that we don't get surprised with any kind of a surge. And St. Francis is available to accept patients. We have not had to use St. Francis to the level that we have the capacity to do, have the potential to do. But right now we are starting to plan for what might be coming. We're trying to reduce the risk of having those hospitalizations really pick up. But we do see a very early increase in the use of hospital beds, and therefore with what's going on in the country, it is really important that we maintain a very conservative and a very forward-looking view of the state of West Virginia, because our job is to try to make West Virginia the safest it possibly can be, with the governor and with our leadership, for the citizens of the state of West Virginia, and save as many lives as possible during this very unprecedented time. So thank you.
All right, thank you, Mark. Next to David Beard with the Dominion Post.
Hi, and I'd welcome any thoughts from the governor or the medical people on my question. Every day or every one of our briefings, we hear an encouragement to do the right thing to prevent the spread of the virus. I've traveled to several other states in recent weeks and seen the measures they're taking to prevent the spread. And you can see on social media and TV that people across the country know about mask wearing and social distancing and all the rest. And yet the numbers nationwide are still spiking. Putting aside, closing all the businesses everywhere and putting aside some kind of sweeping federal mandate that probably wouldn't be legal, is there any additional mandates or measures governments across the nation can do to slow this down, or is it just a matter of relying on daily cheerleading and crossing our fingers and hoping people will exercise some common sense? Thanks.
David, let me give a shot at this. First of all, you've been on these briefings day after day after day, and I appreciate all the good questions and reporting that you've done. I hope, as you've traveled to other states now, I hope you've been really careful too, because I don't want you bringing this back in here on us and everything. And I'm just teasing, well, in some ways, we all, if we happen to go out of state, we all need to be really cautious, and because a lot of other states are having way worse situation than what we have here. But David, here's the real straight stuff is, we in this incredible union have liberties beyond belief, and they drive us to our excellence all throughout the globe. I mean, do they not? And in doing so, we are a proud people of our freedoms, and we do not want them encroached upon. And so we just do the very, very best we can a lot of times. And in this situation, you know, we all know of the ramifications of shutting down, you know, other things on a bigger scale. And we know that honestly, the actions could be worse than the disease. And so we continue to do exactly what you said. We continue to caution people, and we continue to cheerlead, and we continue to encourage every day. Now, you know, with all that, I oftentimes think, and I want everyone to hear me on this, I oftentimes think about the dilemma of shutting down the most powerful engine of all time, the United States economy. Think about our president just a second, and if I'm boring you, then turn the television off. You know, but if I'm not, just listen to me just one second. Our president had a stock market that ran to right at 29,000. Absolutely, the unemployment rate was so low that it was off the chart. Every business was looking everywhere to be able to find someone to hire. The absolute engine of the United States was running at its highest capacity, period. Now, what in the world would ever make anyone shut that down? And he had health officials that came in, and I know health officials came in and said, Mr. President, with what we have going on here, if we don't move right now, we're going to lose millions of people. Millions. And so he made the decision to shut down the engine of this great country. Well, in that, you know, David, we didn't lose millions. We lost hundreds of thousands, which is bad. And he drew an incredible amount of criticism, of how we've handled this from all the way through it. Well, David, I would just tell you just this. What he is doing, what I am very hopeful of, what the health community is hopeful of, now we know the ramifications of shutting down. And we know how catastrophic that can be. We know. And we know absolutely what we're dealing with here, and I will promise you to God above that the president of this country and the health experts all across the land are really dialed into one thing, and that is just this: trying to some way bridge us to that vaccine. Now, David, it may not be here. It may not be here in November. It may not be here in February. It may not be here for months even after that, but we hope and we pray that we're really close. And in doing so, we know the ramifications of shutting down. Absolutely, it can be catastrophic to us. Everybody is trying to do exactly all we can. You listen to Dr. Clay Marsh, a superstar beyond belief. He says the power we have today is the mask and all the different things that we do, which is our vaccine today. The power we have tomorrow is the vaccines and the medicines that are out there that are on the way. Absolutely. We've got to use the power we have today. The power we have today is the mask and all that. We've got to cheerlead. We know that shutting down, the catastrophic ramifications of that, what they are. Now, David, I don't know. I don't know how I can answer it any better. Absolutely, I hope that I've given you all the information that you asked for, but really and truly, I just felt like that what I needed to do was go through what I know our president was facing and what he's dealt with, and really and truly what I'm trying to deal with here. And when it boils right down to it, then what we've got to do is what's happening all over the place, and that is cheerlead ourselves, and absolutely just keep trying in every way to move this thing along.
All right, thank you, David. Governor, I'll turn it back to you to close out.
Sheesh. You didn't have to do that right off the get-go right there. But anyway, I really don't have anything else. I want all of our local health departments to know that we stand ready. I absolutely want to help in any way. We know the great work they're doing, and we just want to help them. We just want to absolutely supply them with more machines and manpower and anything and everything we can do to help them. It's the same thing with what's going on in the schools. I know everybody is tired all across the spectrum. For crying out loud, I am too. I'm sick and tired of wearing a mask. I'm sick and tired of just being, not being able to sleep and worrying myself sick and absolutely just working around the clock to try to do anything and everything I can do. What are the choices? There isn't any. There isn't any. We've got to some way do it. And that's what we're going to have to do. Now, we all need to really try to reach out hands and help one another. I congratulate our Bureau of Senior Services and everything and all the great stuff they're doing. Couldn't be any better. And just remember all those that we've lost in your thoughts and prayers. And again, I'm sorry we got the numbers wrong and everything, because we want to be right, especially on the people that we've lost. But nevertheless, we're going to continue to try to do everything we possibly can, and I hope to goodness that we don't have just petty criticisms on how we tweak and change and do things to be able to help people when we can help them, because we're going to try to keep everything as safe as possible, and we're going to try to continue to help our kids and help everybody that we can possibly help along the way. But thank you again. Thank you all so much.